Okay guys, we're going to talk about capillary sticks, refills, and more. Okay, so what you see here is a variety of different lancets. Okay, that's what we call these needles here. They're called lancets, and they're for capillary blood. So all these vessels that are in the body. And so that happens to be on your fingertips that we will be using. So you want to use the right size for the right person. And so as you see these right here in the front, these are for heel sticks. So they're for infants, and you see the little tiny feet on there. They kind of indicate that they're for heel sticks. Now, the depth is very important. You don't want to go further than 0.85 mm, that's millimeter, or to 1 mm on a infant or a preemie, especially a preemie is 0.85. Now, on how do you determine that? These certain apparatuses don't go any further, so that's why you got to grab the right one in comparison to the other one. So as you can see, I'm going from small to large when it comes to the sizes, and you see the different colors, and there's different manufacturers. It just depends on what your lab or where your lab is buying from is what you're going to get. Like, let's just say this one, you can get these on Amazon, or you can get these from a delivery company, and a lot of companies just they use standard, or they'll find the cheapest. Okay, now let's go over to these. Like this one here, this yellow one is I believe this is an 18 gauge, and this one is a 23 gauge. Remember, what did we say about gauges? They go from the largest size, or the largest number is the smaller needle. So if this is a 23 and this is an 18, which one is the bigger needle? If you're saying the 18, then you would be correct. Now, going over to these ones, these are like for blood sugar. So we don't need a lot of blood, we just need a drop of blood. So these are actually size 30. Yes, really tiny, okay? So, and all these pretty much work the same. I'm gonna show you this one because we utilize these more. So we've got the lancet, the push button, and then we've got the stopper on the top. What you want to do is twist this, but you can't really pull on it too much. You want to twist it first and then pull, because it is a spring inside of here. So this is actually spring loaded. Okay, so once you pull this, and then you want to put this on a finger, which I'll show you here in a minute, and then you would push this top. Now, some of them don't work like that, so you got to get the manufacturer's instructions on how they work. Say for instance, we were using these for blood sugars. Well, you want to put the lancet in here, you take the little top off, and then you put the cap back on. As you can see, it's got a little apparatus where once you put the cap on, well, you want to stick this in, push this down. As you can see, you pull the cap off, and these just twist off. And you got to watch yourself, because you can stick yourself. I'm trying to use one hand here. And you can see this needle is very fragile because it's so small. So if you do bend a needle, you want to get another one. So once you put that cap back on, and you got this plunged back, and then once you put it on the finger, you want to push, and you see how that spring loads upwards. Same way, same thing with this one. You go down, push, springs up. All right, so those are the different types of capillary lancets. That's what we call them. Now we're going to go down here to the actual testing process. So this is called capillary sticks, okay? These capillary sticks, capillary refill tubes, you'll have to fill these all the way up, and we don't want any bubbles, which I'll show you how that works. The end of the top there, the colored portion, tells you what size it is and what's in it, if there's anything in it at all. Now, this is where it gets really different. Now, remember I taught you the order of draw when it comes to the regular tubes. Well, look, this is a red tube, but it says sodium heparin. If you remember my lecture from last time, you remember sodium heparin was in the green top. Well, it's totally different for capillary. So we'll learn the capillary order of draw as well. And then you've got these capillary tubes here. This one is green, as you can see, and you gotta, So the grain still remains the same. As you can see, it's got the little thoracic gel or polymer gel at the bottom. So yes, it's a separator. So what is it? A PST, right? And then you've got your red top, which this one has no additive in it at all. Okay, so and then you've got your gold top, which has a separator just like your SST, and so this all produces serum. Okay, but what's important about this gold one, it's also a bilirubin tube. What do I mean by that? If you're going to pull for a bilirubin, you got to protect it from light. Okay, that is actually a substance that's delivered from the liver, and so if they're checking that, they're checking for liver, but it will be destroyed in the light. So we either have to have a brown tube for bilirubin or put some foil around the tube to protect it from light when you're transporting it. Next we have our microslides. I'm going to show you how to do a microslide. What are we doing this for? Well, we're trying to do a complete blood count. Remember I talked to you guys about a complete blood count, white blood cells, red blood cells. So we put a drop on there and then we smear it. That's called a blood smear. Will you guys be doing those? Sometimes you will, but a lot of times you'll just pull the purple tube. These require EDTA tubes, and then you will just deliver that. But you still need to know how to make these slides. And then you would place these slides to dry, because you cannot transport any slide when they are wet, and it takes about an hour for them to dry. This right here is a capillary station, because I'm going to show you after we get the capillary refill, we're going to stick it with some putty here. Let's just show you after we get the blood in there. And as you can see, let's get this focused. This is capped off now. Once it's capped off, you want to put it in one of these stations and a number. See if I can see this through the phone. And then, of course, you see number 17. Well, number 17, you would have a log, okay? So number 17 would have either the medical record number, date of birth, and patient name. And also, when it comes to your capillary tubes, you want to use a label. So you'll put a label on there. A lot of times we use, now follow your facility guidelines. Some of them will not let you flag a label. What I mean by that is you put one on one side and you kind of flag it like this. On the other side, forgive me, I'm trying to do this with one hand, and that's how we do a flagpole type label. So just follow your facility instructions. Lastly, we're going to show you blood sugar. So we got, as you see, there's so many different types of manufacturers. Now this is the newest, and this one is actually wireless. It's pretty cool. It actually gives you your biometrics. It takes a tally of all your blood sugars for the week or month, and it's actually touchscreen, so it's pretty cool. All right, so next you will see me do a capillary. All right, so like I said, I've already talked about the various sizes of capillary lancets. Now I'm gonna get ready to stick a person. But first, you wanna get consent, you wanna verify name, date of birth, and also medical record number. If they have a wristband, you wanna check that as well. I wanna come over here real quick because we need to know where we're sticking. So as you can see, there is a no area. So with on the finger, you want to go kind of perpendicular to the grooves. So what does perpendicular mean? It's kind of like a T. So you're going against the groove. And why are we going against the groove? Because we want a better open area so we can get more blood out and we don't have to stick them twice. So that's exactly, so you want to stick them laterally, not in the middle, but where you see those little red lines, you don't want to go lower than that, and you don't want to go towards the middle, okay, because that hurts. So we want to stay to the sides, and your needle needs to go perpendicular. All right. Now, let's talk about the fingers that you can do. Let's turn the hand over. You can only do third and fourth finger, okay? So your middle finger and your ring finger on each hand when it comes to you being a phlebotomist. And what I'm talking about, so you see the finger grooves here, you see they kind of go in a swerve. You want to cut against the grain. So you're always going to cut against the grain. This on laterally. Lateral is the sides. middle is medial, lateral is the sides, okay? So now let's talk about our supplies. I've got a Band-Aid, I've got an alcohol pad, I got a piece of gauze. So we're going to clean the area first. The first thing we're going to do is the capillary refill. I'm going to show you what to do and what not to do, okay? So first thing we're going to do is clean the finger. I already got consent, so I'm going to come on this side, okay? So what I'm going to do is take my alcohol pad and circle around. This is called a concentric circle. Okay, so we want to make sure that's nice and clean. You always want to keep your area clean. Put your stuff in the trash bag. Allow it to dry. Never fan, okay? So you're introducing different bacteria. Now, you say, why do I have my gauze? Because I need to wipe off the first drop of blood. And I can't do that with alcohol pad because not only will it taint the sample, but it can also make you bleed longer. All right, so the needle that I'm going to use, if you remember last time, it was 23 gauge. They have phalanges just like that hub that you have, so I want to hold my needle as such. And remember, I want to twist a little bit because if I pull, I might disengage the needle. So I'm going to twist a little bit, and then I'm going to take this out. Here's the stopper, goes in the trash. All right, so some people are nice bleeders, so you don't want to squeeze a finger. What's going to happen is you are going to destroy the red blood cells. That's called hemolysis or hemolysis, and that's destruction of red blood cells. So you don't want to do that. Now, if you're having a hard time, you can have the finger hang down, have the arm hang down, and as you see, as we softly just kind of caress the finger, you see it turning nice and red, okay? So that's what we're going to do. Let me get my stick back over here. All right, so I'm going to hold this. Now, as you can see, here are the grooves here, and we're going to kind of catty corner this, okay, and really punch in. So I am going to, the first drop of blood, and now I'm going to hold this up. Now, you would think I would go down, but I'll show you why we don't go down. So I'm going to go, you see that pressure? It's coming on out. Now let me show you when you do this wrong, okay? So if I allow it to go down, as you can see here, and then I put more blood in, what do I have here? Yes, I have a hole, and we don't want that. So you want to continue. So if that happens, what I'm going to do is either I have to follow your facility guidelines, but you see I got that bubble out, and then I'm going to go back up. Okay, so I want to finish this all the way up to the top. And then when I'm done, and I'm not going to get all her blood right now because I need it for something else. So right now I'm going to putty this. As you can see, there's the stopper. Put it here. Now I'm going to use this finger for a different action. And so next, I left a little bead of blood there. Of course, you don't want to do this consecutively. You want to, because it will all be dried up, you want to do another. If you have to do a finger stick, you probably want to use another finger. But since I got a little drop of blood here, I'm going to utilize it. I'm going to use my BioTail here. As you can see, there's 3 different types. There's so many, but this is wireless. So we're going to turn this one on, and we're going to get one of these little testing strips out, and as you can tell, it's got a little microchip back there and a microchip here, and what you're going to do is insert it where it tells you to insert. So I'm going to put it in here. It's going to ask me for a drop of blood if I have this in correctly. Apply blood, and you just need a tiny bit of blood, and let's go. All right, now it's going to calculate. I'm going to get this and tell her to apply pressure. Oh wow, she's got a great blood sugar. It should be between 60 and 120, and she is doing great. All right, so after you're done with that, this goes in the sharps container, and then you log it and turn this off. I do want to show you here though, every time, and follow facility policy, but when you open a new bottle of strips, you need to check the manufacturer date, how many should be in here, and then there's a testing strip guideline. So it says a level 1, level 2. What that means is low and high. So this has glucose in the bottles, and this will test your monitor. A lot of times in the morning, you'll have to test all your monitors that day before you get started. All monitors that are in use, that's a test question, you need to test them. So let's go ahead and test this one. So I'm still in test mode, and so we're going to continue this. It's telling me to log it, and I'm going to go here, and I'm going to go to solution test mode, and we are going to sorry, here we go, control, there we go. All right, so it's telling me to do the green one first. So what I'm going to do is I'm going to get another strip out. Yes, you do have to waste a couple of strips for this, and they will factor that in when they're buying. So it's asking you to apply the testing solution, and you just need a drop, and let's see what it's going to be. And it's 120. So that is between 88 and 120, so that checked out well. If it didn't check out well, and we want to verify on here, so and finish, and we're going to do the next one. And all that, though that didn't have blood on it, I'm just very used to, that's just fake blood, glucose, sugar, but I'm used to putting that in there. So let's do that again, and let's do level 2, which is the blue bottle. Gotta watch out for these touch screens because you could accidentally touch something. Okay, so now I'm gonna apply the blue, and let's see if that works out. All right, applied it a little bit, not within the groove. There we go. All right. As you can see, you can't get that on top of the test strip. And 207, let's see if that falls within. Absolutely, that falls within level 2. So we can say, yes, that verified. So what happens? Yeah, you want to put that out of commission, take it to your supervisor, and definitely you might need another one, or this might need to go manufacturer warranty, it might need to go back. All right, so next we're going to talk about capillary refill. Okay, going back to capillary refill, as you can see, again, I just want to remind you that this should be all the way filled. I didn't do that for just showing for demonstration purposes. And then, as you see, I told you there is a little red strip that tells you what's in, what additive is in the tube. Now, on a normal tube, you have learned in the order draw and the additives that there's nothing in this tube, or that would be silica, but that's not the case when it comes to capillary refill. This has sodium heparin in it. This one is a light blue tube, and I've told you earlier in the order draw and in regular tubes that light blue, if you guess it right, can anybody guess what the light blue is? If you said sodium citrate, that is correct. All right, but guess what? That's not what's in here. This light blue has no additive. Yes, so you've got a different order of draw to learn, and actually different colors to learn when it comes to capillary refill. All right, so I wanted to finish with that on capillary, and we're going to go to microtainer. Again, you can see the little lines here, so find out from the lab how much you need in here. Either fill it to that line or that line, and go from there. So now I'm going to use my client again to do another finger stick. A very reluctant client, I may add, but it's okay. So I'm going to, sorry about that, I'm going to wipe in a concentric circle, put that in my trash, allow that to dry, and then I'm going to get my 23 gauge, twist, pull off. As you can see, there is a needle in there. Okay, I'm going to put this marker on here. Now the needle, this little area, that's where the sharpness of the needle is, so usually you want to twist it so it can be perpendicular to the finger. So I'm twisting in a kind of catty corner way, as you can see. So I want it to go against the grooves. So right now I'm going to hold. Now, when I press on this, I really want to press into the skin. If you just put it on the surface and push, you're not going to get enough blood. I need to fill up this microtainer, so I need a nice stick. So remember to hang the finger down and to make sure you softly and gently kind of caress the blood to come down. You never want a hard milk because you can destroy the blood vessels. So now I'm gonna, earlier I kind of went down a little low, so I'm gonna go a little higher because that's where you should really go. So again, hold the grooves and then press down and wipe the first drop of blood off. Put that in your biohazard and allow the blood to come out. So what I'm gonna do here, I've got her kind of twisted. Sorry about that. You can see there's a lip here, and so you don't want to scoop the blood, but you want to make sure that it drops inside, okay? So never scoop, because what you're going to be doing is getting skin, and you don't want skin because skin has quite a bit of course, has epithelial cells, and you might get some other substances that you need. So I'm not going to go all the way and fill this up for the sake of my client right now. But just know this takes a little time, as you can see. You want to hang the finger down, and for purposes right now of just showing you this, I'm just collecting. So I'm kind of gently caressing, and I'm collecting. I'm going to stop here just to show you that's not much blood. So that's how long this kind of takes. But look at all this good blood coming out. So if you get a good drop, if you get, and you can pretty much sit here and milk that. I like to get mine down because it mixes well, better like that. So anyway, I'm going to sit this here, and I'm going to cap that off. Right now, I'm going to get a piece of gauze. I'm going to wipe first, and then I'm going to have her hold, okay? You'll have a station where you have like little holders that this holds in place that they won't fall over or anything. Now, you want to put this on top. Again, flagging the label is probably what you're going to have to do. And they'll probably have pre-made labels already, such as what you see here with the flag, and that's already pre-made, and so a lot of times you'll just stick that label right on there and send that to the lab. Okay, if you don't have a label, then yes, you have to make one up. Name, date of birth, your the time, the date, your initials, and sometimes you'll also have to have the medical record number. And then I have one more thing to show you, and we'll be done. Okay, so you can see I've been playing with the red dye a little bit on my fingers. I put it in here for sake of my clients so I can show you. So this is microslide. What are we looking for? On a microslide, they're looking for a complete blood count, and we need a feathered edge. And what do we mean by that? We want it thicker here and feathered more at the end. As you can see, here's some attempts at doing that. I'm showing you what not to do as well. So right here, it's pretty nice. It's a little too light though. This is what we want the feathered edge to look like, and more kind of thicker in here. So this is really good here, where you got a kind of thickness and you got a lighter version here. This one here, the only thing wrong with it is it's got some grooves in it, but it should be a little lighter at the edge. That's what happens when you're looking at, when you're doing it with this type of blood. So what I did here is I got an EDTA tube, and this is fake blood, and I put this little dropper stick in, like this. And of course you wanna have gloves on, this is not real. And I put the dropper here, and what I'm gonna do is just put a perfect bead of blood on there. And then how you want to make a feathered edge is you're gonna have another microslide. You're gonna bring it around here at about 30 degrees, and then you're gonna just slide it off. Of course, you see this is not real blood. What it would have done is made a thicker here, and let me just show you how I swipe. So just for the sake of practice, I let the bead of blood came up, I put my slide on top, I let it go across the top here, And then at first, I'm doing a real light wipe and then a lighter wipe at the end. That's how you make a feathered edge, okay? So again, sometimes you'll have to do these, or you'll just send the whole tube to the lab and they'll do it in the lab. But again, the reason why we want the feathered edge area is the lighter part here, like this would be kind of perfect here. The lighter part would be where they're going to visualize the platelets. The platelets is where the clotting factors are. And then you have like your white blood cells down below and your red blood cells, and there are many different types of different white blood cells. Anyway, so that's how you make a microslide. Again, you'll have to label it, so you would put a little label on the bottom, and you would put somebody's name. Sometimes it's frosted at the bottom, so you use a pencil, you put their name or their identifying marker there, and you have to let these slides dry. Again, follow facility policy. It usually takes about an hour to dry, and then you send these slides in a special type of delivery box. A lot of times we're going to let them dry, not flat on the surface, but we'll put them, you know, something like this, and allow them to dry before we send them. And again, as you can see, it has the number, it's all numbered, so I know that this is my client, a different person name and a different person name, and you have to make sure to log it. All right.